All right. Welcome, everybody. I know a few people are still joining, but in the interest of time and excitement, we will get started. I am Bonnie Lynn Sweenor, the director of the Johns Hopkins Disability Health Research Center. My visual description is I am a disabled middle-aged white woman with blonde shoulder-length hair. I use she, her pronouns. I'm in my office in Baltimore and respectfully acknowledge and give thanks to the Piscataway tribe, who are the indigenous people who are the traditional owners of this land. And I want to warmly welcome all of you to our final installment of the 2023 Disability and Public Health Seminar Series. I'm very excited for our guests and one of my colleagues, Dr. Denis Newman-Griffis, to discuss the nexus of disability, data, and artificial intelligence. This seminar series is a joint effort from the Johns Hopkins Disability Health Research Center and the Bloomberg School of Public Health. The goal of this series is to better connect disability justice to public health by learning from the disability community, activists, scholars, policymakers, and overall change makers. I want to give many thanks to my co-lead for this series, Dr. Jennifer Deal, Dr. Franz Castro, and immense thanks to support from Mindy Mchowski, Caroline Cirilli, who are assisting us with this course and with this seminar. And thanks to our captioner, Laura, and our ASL interpreters, Kristen and Jackie. And so before we begin, we have a few logistics. Next slide. So today's discussion, as you absorb the information, we hope that you come up with some questions for our guest. Please use the Q&A function to type in those questions. Your message will be sent to the panelists who will review and curate those questions and read out loud to the moderator on your behalf. We have ASL interpreters and closed captioning for today's seminar. CART services can be accessed through the Zoom link in the chat or the CC button on the bottom of your Zoom screen. For awareness, this seminar is being recorded. And if you experience any technical difficulties, please contact Mindy at epitts4@jhmi.edu. And without further ado, I am very pleased to introduce our speaker today. Dr. Denis Newman-Griffis is an assistant professor of data science in the University of Sheffield and information science, and a visiting fellow of the National Institutes of Health Clinical Center. Their research focuses on practices and principles of artificial intelligence and how these interact with social responsibility and equity, particularly in disability. Their work draws on methodologies from natural language processing and machine learning, critical data studies, disability studies, metascience, and health informatics. They're an inaugural member and executive group member of the UK Young Academy and recipient of the American Medical Informatics Association 2021 Doctoral Dissertation Award. I believe we're going to put a link to yes, I think so. Right. We're going to put a link to Dr. Newman-Griffis' academic webpage in the chat. And I am really excited for this conversation. Data is certainly near and dear to my heart. I've had many conversations with Denis, deep conversations about disability and data. And I hope you all enjoy this discussion. Lived experience in digital data, learning at the nexus of disability, data, and artificial intelligence. Turning it over to you.
Thank you very much for the really lovely introduction. I will try to live up to it and live up to the standard that you've set with this seminar series. I'm really excited to be here with all of you today. So as Bonnie said, my name is Denis Newman-Griffis. I also go by Denny. I use they, them pronouns. My visual description, I'm in the rare position where I still actually look something like my academic profile picture because it was taken pretty recently. I am a youngish white person with curly hair that's currently blue, wearing glasses, have a bit of a beard and some blue earrings, masculine presenting, as you may guess from my voice, at least what you can see. And I'm really excited to be here with you. And what this talk is really about is not so much kind of telling you what I know or what I need you to know, but wanting to share with you this sort of learning process that I've been going through at this nexus of a lot of things coming together and meeting of disability data and artificial intelligence. And I want to put that in context, if I can get the slides to work, by starting with acknowledging my positionality and some of the history of how I've gotten to this position, because that I think is important context for this discussion. So my positionality is I am a white middle-class academic, I am queer, I'm neurodivergent, and I identify as non-disabled. Kind of historically, the work that I've done has moved through a lot of different fields and a lot of different sorts of areas of practice. So I started my PhD training, my professional training, in very technical areas. So core computer science, artificial intelligence technologies. I had the really fantastic opportunity to then move into a bit of a government setting. So still doing my graduate studies, but working with a really fantastic team at the NIH Clinical Center and working in collaboration with the US Social Security Administration on sort of AI in the setting of government disability benefits. I've also increasingly started to cross over into the healthcare sphere. So I've been working in health informatics for a while, but thinking particularly about questions of information and disability in clinical practice and health services beyond just the benefits setting, but to other sorts of settings as well. And now I'm in a social science department at a university in the UK, so a lot of context shifts going on there. And what I'm researching is the sorts of practices of how do we do AI, how do we understand the ways that we're working with data and technology. And so this very sort of circuitous journey has given me a pretty wide-ranging perspective and given me some really fantastic learning opportunities in the process. So what's been a running thread through all of this for me, and what I want to focus on in my talk today, is information. And what you have in front of you is a diagram that is going from a wireframe of a person on the left that is representing a human being in all of their lived complexity, all the things that go on in their life, everything in their personal situation, and so on. And we move right along a set of arrows. And as we move farther right, we have arrows falling off and falling off and falling off. And these represent losses of information about what is going on with this person. And when we reach the far end on the right, what we have left is just this sort of vague, blurry outline of a human being that is telling you very little about this person's individual experience, what their life looks like, and what we as information consumers should be doing with them. And this loss, which really functions to erase individual experience, is a major driver of inequity and injustice in disability. Now, we can also imagine something better, where, again, we start with the fully fledged human being on the left, and we still have our arrows, and we're still falling off a little bit. As we go along, we are still going to lose information because we can never capture all of the infinite complexity of any person, of any human being. But we can imagine that through better information practices, we can end up with something where we're retaining a lot more of this information, and we can end up with a pretty strong outline of a person. So here, the image on the right is now a stronger outline of this person, still maintaining some of the very exciting gray color that's going on inside the shape. And what this represents is having a bit more of an understanding of this person as an individual and how they're living in the world. This better developed picture is what we want to aim for. And to make this concrete, because this is a public health setting, let's take a public health scenario where good information is at the heart of what we want to do. So we're going to imagine that we are working with the Baltimore City Health Department. Some of you may actually be doing this, but pretend for the moment that you're working for the imaginary version. And what we've got is we've got a pot of money that we need to spend on quality of life improvement. But the question is, where do we spend it to make the greatest gains? And one of the things that we know is there's some particular neighborhood that we're going to focus on that has unusually high incidence of disability among the people who live there. And we know that this particular disabled population has lower life expectancy and worse health outcomes than other disabled people in the city, and certainly than other population within the neighborhood. So what we want to know is what's going on and what can we do to improve it. So this is our problem. Now let's think about when we're in the low information setting, which is where we're usually working now. What we can know from the data that we've collected is, well, let's imagine that we know that public transit is underutilized in this neighborhood. There are a lot of social work appointments that are being scheduled but are missed. And most people in the neighborhood are getting their health care through encounters at the local emergency room. So this is what we know. So what we're going to do is say, okay, well, the buses are underutilized, so let's reduce some of those services to add resource to caseworkers and to ER support. Lo and behold, we do this and outcomes get worse. So what's going on? Well, in this situation, we don't know. But if we imagine a more informed approach, we can start to understand what's going on. So let's imagine now that we go and we, through better data practices, we're able to get information from the people in the community. And what we learn is, well, there's a lot of people here who are struggling with mobility and struggling with depression. We learn that a lot of buildings have elevators out of service. And a lot of the buses that are running don't have appropriate access ramps. And we also learned that the phone service, the local phone services, are underfunded and unreliable, and there's no green space in the neighborhood. So there's a lot of things going on. But most of these are actionable by us as a public decision-making body. So we can spend our money repairing and beautifying the local parks, getting elevator maintenance up to scratch in the city-owned buildings, updating the bus fleet, and putting some political pressure on phone providers to improve their service. Now, we're imagining this is a very efficient and effective public health department. And what we see is that emergency room usage decreases, there are fewer missed appointments, and outcomes improve because we are able to address some of the more root causes that are going on with the individuals in this neighborhood and their personal experience. So there are a lot of things that we can pick apart and critique about that particular example, but the main idea is this, that getting better information on lived experience makes the difference between working with and thinking about an undifferentiated population, a bunch of vague outlines where we have raw statistics only, to the extent that statistics are ever raw, and moving then to more of a population of individuals, where we can start to understand what's going on with individual human beings within this group. And what makes this difference between the undifferentiated population and the population of individuals is a greater depth of information, having information from multiple sources, and having active engagement with the community in how we get and use that information. So I've talked for a while without mentioning AI. This is where AI comes into the picture. So what AI technologies can help us to do is to wrangle some of these challenges, to get traction on some of these challenges of working with multidimensional information. First off, we can think about capturing data. That when we want to have a multidimensional understanding of somebody's lived experience, we need multidimensional data. And this is a place where AI tools, digital technologies can really help with data capture in a lot of different modalities. Once we have data, you need to get something out of it. So we want to combine these different sorts of data sources. We want to combine the dimensionalities of the data that we have. And the challenge that you run into here is that, well, it's big and it's complicated. So you've got a lot of data, a lot more than we're used to being able to work with. And we have a whole lot of variables, and we're not sure how they relate to one another. So here, AI techniques can be of use in helping us to manage these large, complex, high-dimensional sets of data. And finally, in terms of what comes out of that analysis then, we've done capturing, we've done combining, now we want to communicate. What have we found? And there are many different kinds of insights that you can get from the same set of information, and many different ways of finding those insights. So part of the value of AI tools as algorithmic and therefore repeatable methods is to help with tracing the provenance and the interactions within large complex data, and helping to synthesize consumable, understandable findings from large volumes of data. Now, having highlighted the potential roles of AI in this space, it's worth taking a moment to define just what we mean by AI. So we throw this term around a lot. We often think of AI, certainly there's a lot of popular narrative around AI, as a single coherent, if rather ill-defined technology. But it's really, I think the way to think about it is more as a paradigm, as a way of thinking about how do you use knowledge and data as part of the way that we use technology. In other words, we want to ask this question of, based on what I know about the world, what I know about people, their situations, how do I computationally do a thing, do this thing that I want to do? And we can start then to draw some relationships between the various terms that we encounter of AI, of data mining, data science, machine learning. And we can think about this in terms of the verbs that they correspond to. So AI is about doing things in a way that is informed by data. Data science then is about asking questions, learning things from data. Data mining is about finding patterns in data. And machine learning is at this overlap between AI and data mining, where you're doing things that are based on patterns observed in data. So all of these different verbs can interact with one another. You can use AI to do data science. You can use data mining to inform your data science, to design AI, so on and so forth. But what differentiates these terms is the goals of what you're trying to do with them. So with that context in mind, let's come back to ask, what is it that we're interested in here? What do we want to happen at the intersection of data, of AI, and of disability? Well, fundamentally, we want to improve our ways of understanding and working with information about people's experiences, their joys, and their barriers in the world. And I want to highlight the word joys here because it's really important. This is a case where it's very important to not just go for a deficit narrative, to say, we're looking at multidimensional information, we want multidimensional experience. There's a lot of joys, of positivities, of priorities, of preferences, all of these things that are not just the standard sort of limitations and impairments and all the deficits that we tend to talk about in the disability setting. And this is something where, again, this capacity to work with multidimensional information can make a big difference on this. So what I want to do then in the remainder of this lecture portion of today's discussion is to start talking about 3 anchor points that I've been coming to study in differentiating between the promise and the perils of this intersection of data and AI in disability. And these are The anchor points I've labeled here as datafication. So asking the question of how are people being represented in data, of design, asking the question of how are these technologies built, and of dialogue, and always asking the question of how are communities being involved in this process. So our starting place is the data and the process of datafication that creates it. You may have heard this phrase that something is only as good as its data. But what we don't tend to say is then this following question of who decides what counts as data. Not everything turns into data. All the observations that you make in the world, only some of them get turned into data, and they get turned into data in specific ways. And this is where it starts to be really important to make a distinction between information, which is what we want to know or communicate about the world, and data, which is our recorded observations of the world. Data are not information. They can carry information, but they will never carry all of it. And there's much more to information, to communication and interpretation of it than the data alone. So coming back to the arrows that we started with, then from this perspective, we can start to flesh this out a bit more and start to identify, specific barriers that lead to the information loss that I was talking about at the beginning. And this image is particularly highlighting specific barriers that we encounter from a clinical practice perspective. So going again from our fully fleshed out wireframe person on the left, we have our arrows dropping off, but they're dropping off at specific barriers, things like contextual measurement limitations. It's hard to measure people's contexts and define what that means. We lose information from the underemphasis of patient perspectives in the data that we collect and the data that we use. We lose information from technical challenges, from standardization in electronic health records, health information systems. And so through these specific barriers and others that we identify, we end up again with this kind of hollowed out outline of a person that is a really underinformed picture of a person's situation. And that picture, that what is represented in those data, that's what then tends to go on and get used in decision making. So that leads to poorer quality decisions and lower quality outcomes and inequities that result from that. So thinking then about more multidimensional data, when we imagine getting more multidimensional data, drawing on effective use of AI technologies to do that, to support capturing and analyzing those data, we can redraw this arrow where we're getting better information. So now, again, starting with our fleshed out person on the left, we have our arrow with smaller arrows coming off where we can use things like digital measurement and patient-reported context, drawing on information from the patient directly, which we don't use often enough. Patient-reported experience and outcomes can help to lower other barriers. Using technologies like natural language processing, time series analyses with sensor data, et cetera, these can help to reduce our information loss, keep our arrow of what information that's carrying through a lot bigger. We get a more informative picture of what's going on with this individual, and that can lead to better healthcare and to better policy. And getting this is something I want to emphasize here, is that getting this better and more multidimensional data involves pulling in a lot of different kinds of information from multiple sources. Here, again, because we're focusing on the clinical interaction, what's being called out is just clinicians and patients, but we need information from both clinicians and patients. We need to understand functional assessment measures that are going to come primarily from clinical observations. We also need to understand personal experiences, and those are going to come from the person who's experiencing them. And we need to understand context, and that can come from both. So you're always going to be drawing on multiple sources and multiple kinds of information coming from each of those sources. And so you can imagine this then moving outside the traditional clinic paradigm, where we can then draw on a much wider variety of sources and a much wider variety of information. However, these potential benefits of better information, as we've defined it, and the use of AI to help with getting and using it come with significant risks that we need to be cognizant of. And I've highlighted a couple of them here. These include the kind of risks that we need to be aware of include issues of bandwidth that, as I said, you can never capture all the information. You know, there's infinite sorts of observations that you can make about the world. But the only data that you ever have to work with are what you chose to capture and how you chose to capture it. So there's a severe imbalance between what was recorded and the way it was recorded and what wasn't recorded. And you can never really get at that latter chunk. Less tangibly, there are also some really critically important issues of power at play here. Data collection and use, data capture is an exercise of power. It is inextricable from that situation, that the way that we decide what counts as data, the way that we decide what becomes a viable and reliable source of and process for collecting data, that is an exercise of social and political power. And after collection, we then have this additional issue that data are perceived as neutral. They're perceived as authoritative, and they're perceived as true, that these observations don't have a history. They are simple facts about the world. And none of those adjectives, neutral, authoritative, or true, none of those are actually true about data, because data are always going to be political, and we need to analyze them and understand them as political artifacts. So the critical question from this perspective is asking, whose perspective are your data representing? They're always going to be representing somebody's. So whose perspective are they representing, and how? Now, with data in hand, then, we'll set aside the questions of the representation of those data. The next step is to think about, well, we want to design a technology to work with the data. And there's no one right way to do this. So with the same data and the same kind of goal that we want to aim for, there are many, many different kinds of ways that you can define and implement that. And the choices that go into that process really define how that technology will act in the world and on whom it will act and how it will affect them. We'll take an example from some of the work that I've done, thinking about using text mining or natural language processing methodologies to help with identifying information about people's functional limitations in health records. Where here, the goal that we're setting forth is, we have health records. We want to find information that's relevant about what's going on with this person. And we can define a few operational steps to this in terms of finding where the information is. In this image of kind of broken out from this original narrative, we can see a chunk of patient is independent in showering and shaving. That's one chunk of information. He requires verbal prompts to initiate brushing his teeth. That's another chunk of information. We can then take each of these and start to categorize and say, what kinds of activities are these describing? So we can break this process down into defined operationalized chunks. But our overall goal is, we're saying we want to find what's relevant that is described in this text. And that process, what I just described through that illustration, the process of breaking down that goal and the data that you're working with into specific operations, that process itself becomes an important site of analysis and of intervention. When we think about designing AI technologies for information analysis, which is a specific subset, we can start to break down this design process into specific decisions about, what is it going to work on? What is the scope of this technology operationally? What kinds of constructs are we going to analyze? And what will we use it to work on? Where are we going to apply it? And we can break it down into decisions, again, specific human-made decisions about how is it going to work in terms of input data, How will it be used within broader contexts as one piece of decision-making, one source of information? And how do we build it? How do we make this thing actually work? And if you imagine going back to our text mining example, where our goal was we want to find relevant information in text, well, we can think about what counts as relevant and how we might define and operationalize it through very different definitions of disability, where we can be focusing on medical aspects, we can be focusing through the social model, we can be focusing on political relational aspects, among many other ways of thinking about it. And each of these comes with different preconceptions about what is disability, what sorts of power goes into the creation and management of data about it, and how are we going to measure it? What are we going to measure and how are we going to use it? And what we see is that, maybe unsurprisingly, different definitions of disability produce wildly different technologies, even trying to address the same goal with the same data. And those different technologies are going to have different potentials for harm. So the main lesson here is that unquestioned assumptions in AI design sort of lead in practice to this assumption that you have everything you need. You have all of the information. And the process of starting to break down and say, what are the assumptions that I'm making? What are the decisions that I'm making? That forms a site for critical intervention. And that forms a site where we can say, this is where disabled perspectives are needed. This is where a disability-led approach and a disability-centered approach is needed from the beginning of this process. So here, the critical question becomes one of material impact. How, if you're building a technology, if you're designing a data process, how does that process, how does your technology materialize what disability is, and therefore materially affect people who are interacting with a disability context in one way or another? And finally, everything that I've been talking about today needs dialogue. And it needs dialogue between academics and disabled people. It also needs cross-party dialogue more broadly between these complex networks of stakeholders involved in affecting disability experience, affecting disability-related decisions. And there are so many categories and groups of people we can bring into this sort of network picture. You know, here highlighting healthcare, government policy, benefits, employment, transport, the technology design people. But you can imagine this expanding and expanding and exploding and breaking out many subcategories inside this. The point is not to have a, let's say, correct assemblage of people. The purpose is to say what we need is to recognize that we have this networked system and we need dialogue within the elements of that system. And making that happen then requires dealing with specific challenges. And I've highlighted here a couple of these. Again, these are by no means all of those challenges. But that dialogue needs to be disability-led, and more than that, it needs to be anti-ableist in terms of who is in the room, recognizing that if the room doesn't include disabled people, then we're doing something wrong and we are contributing to ableism. Recognizing, excuse me, and also asking then whose perspectives are leading. So thinking about the concepts of what it is that we're trying to measure, what it is that we're trying to work with, those concepts underlying the technology need to be led by disability information needs, not to have disability be a sort of ancillary component of the process. The dialogue also needs to engage with power imbalances. And this one gets, as many of you know, a bit more complicated. But what we really need for this is some understanding of how disabled experience is represented in data and how we can challenge that. So this is the kind of fundamental step, or at least the starting step that we need on this road. So what do we need more broadly to tackle these challenges? Well, we need practices, we need resources, and we need political will. In terms of practices, we need conceptual and practical models for what does disability-led and a community-engaged technology design look like? How do we say this is what the process should be, this is what your accountability measures are, and so on. In terms of resources, we need how-tos. What is disability data? How do we understand it? How do we critique it? And we need frameworks for critical analysis to support that process. And political will, well, I don't want to go down a hole here, but generally we need organization, we need evidence, and we need regulation. We need all of these elements. We need all the things that go into them to turn these kinds of insights, to turn these kinds of challenges we can identify into meaningful and policy-oriented action. So the final critical question here then is one of engagement. How are we in the technology design process engaging with disabled perspectives at every stage of this process? So coming back to these anchor points of datafication, design, and dialogue, we now have these critical questions to at least start to guide our process in each of these areas. And again, this is learning that I'm still in the middle of. This is learning that kind of everybody's still in the middle of, figuring out how do we make progress on tackling these anchor points. We can at least start with these questions of perspectives and data, of materialization of disability and technologies, and of engaging with disabled perspectives in dialogue throughout. So if you forget everything that I've said except for 3 things, this is what I want you to take away. That loss of information about lived experience, that information loss is a major driver of disability inequality and injustice. AI technologies and data technologies more broadly present both potentials and perils for better disability data. And the way we make the difference between those potentials and those perils is through critical practices and co-production with disabled people throughout. With that, I will go ahead and wrap up because I know there's going to be a very interesting discussion, and I'm really looking forward to talking about this with all of you. So thank you very much.
Thank you, Denny. As always, such an amazing and important discussion. I always learn so much whenever we talk, and I'm really excited to have you sharing that with so many folks on this side of the pond today. As questions are being populated, and I encourage our audience to add questions to the Q&A, but as people are taking a minute to do that, I'm going to take a point of privilege and ask you the first question. I just want to reflect back how much I appreciate you discussing how data are a value statement. And, you and I certainly have talked about that and just how important that is to understand. And I just really appreciate that. And the importance of discussing sort of, who kind of calls the shots in data and how critical that is to driving change and assessing bias and promoting equity with the information we have. But so my question is taking what you talked about, and you made a really critical and very clear and moving argument, I hope, to everyone attending to move towards a more disability-centered approach, disability community-centered approach. But do you think that should apply to all use of AI, for example, right? Or do you think that this should just be an approach for certain areas, aspects, uses of AI? I can imagine there's some, who would argue one side of that, who would agree with what I am asking you. Anyway, I'm curious of your thought and response.
Yeah, no, thank you for asking that. I mean, it is a really good question. I think it's always a fundamental question with certainly anything about promoting justice and equity in technologies is more broadly is like, who are you trying to affect and in what situations? I think it depends a bit on, well, so I'll give you the principled answer and the pragmatic answer. The principled answer is, yes, this should always apply. We should always be thinking about, we should always be certainly thinking about with any sort of information technology, and certainly with AI approaches and the role that they have in society at the moment. How is this going to affect disabled people? How is it going to affect queer people? How is it going to affect, people by racial group? And all of these sorts of questions we need to be asking, and we should be asking all the time. Pragmatically, there are different degrees to which I think you can see effects and potential impacts of bias, sources of bias, depending on what you're doing depending on what the information technology is doing. So part of the process of this is taking that initial critical lens of saying, okay, I have a situation where I have data, I have technology, and I have something that's being done with it. And I have something that I want it to correspond to in the world. Let me assess the alignment and the misalignment between those. And let me assess who is implicated at each of those stages. So if we're looking at data about honestly, proving the principled point is it's hard to think of something that doesn't have a disability implication. Yeah, I'm kind of running out of
I know,
ideas.
it is hard. It's like once you see it's everywhere, right?
Yeah, but certainly, we can imagine more sorts of direct or indirect impacts on people, and more sorts of prominent or less prominent roles that that disability and ableist perspectives may play in that. And so I think there's always going to be a balance. There's always going to be a balance to negotiate of really trying to take a critical assessment of who is affected by these decisions that are going into this, and what sorts of risks do those present? How do we mitigate that within the process that we have? And there's a lot of political elements to that, not just in the policy sphere, but in the sort of interpersonal, I need to navigate people's perspectives and needs, and not everybody's going to share these values. And sometimes you need to say this thing that we're trying to do shouldn't be done unless we're doing it right.
Yeah. That's sometimes the hard part, right? When something is already in motion, and perhaps, there's a recognition it's not of benefit moving forward. Well, thank you for that. Thanks for entertaining my first question. And I know we have some questions being asked, and so I will turn it over to Franz to help us guide through the audience questions.
Thank you, Bonnie. We are getting great questions from the audience. So the first question is, what are your thoughts on the use of computer vision technologies for people who are visually impaired? And what should we be cognizant of as researchers so that we do not perpetuate AI injustice and inequality?
Yeah, thank you for the question. It's a really good question, and I'm going to escalate it a little bit because I think that there are fundamental questions to this about the use of AI in access technologies more broadly. So, taking the example of computer vision for people with low vision, the blind, visually impaired, there's a lot of potential there. Like what AI technologies offer fundamentally from a practical standpoint is scalability. So it becomes something where if you want to have an accurate visual description of something that is in front of you, you can, by having a technology that is built for a fairly high degree of reliability and that can be scaled easily to, sit on your smartphone or sit on whatever, it becomes something that is easily accessed by millions of people. And that is a huge potential because it makes it something that can become much more everyday, much more financially accessible, much more practically accessible. And I think it's really important to acknowledge that potential. And that, that goes for computer vision, for visual assistance, it goes for, speech recognition, automated transcription. It goes for all sorts of things that, that we can imagine in access technologies. What we need to be cognizant of as researchers is how well are we doing and who's impacted and what's the risk. So if, there's a lot of good research on racial bias in computer vision technologies, and if we're using them for accessibility perspectives, we need to be pretty thorough about assessing for that. And we need to be, and I think we as a field more broadly, we as a field of research and research management, what we need to be doing is not only asking those questions, we need to be building practices for how do we audit for this systematically? How do we measure what these sorts of biases look like? Not from a, we want to catch people out and wag the finger perspective, but from a perspective of, we know that bias is embedded in human society because it's part of who we are. It's kind of unavoidable in a lot of ways. And we need to be able to have reliable methodologies for saying what's going on, what kinds of biases are we exhibiting, and how can we mitigate that. So a lot of it becomes developing risk management practices and building those risk management practices into the AI research process. That second part is harder because it involves asking for cultural change. The first part, there's a lot of really good stuff to draw on. Making cultural change, that's how we try to not perpetuate AI injustice and inequality, because right now it's the culture of the field that really pushes for that.
Yeah, I just want to thank you for that response and for this question too. And, just say, I mean, this has personal angles for me. And I think, to what you're saying, Denny, is that last part is so hard, that cultural change. And it entails, for many researchers, for many of us, to have moments like we were just alluding to moments ago of saying, okay, I'm the expert in some parts of this, but ultimately I should not have the deciding power, right? And that is hard in so many ways with the systems and places we are in for researchers who are devoting their lives and their careers to certain, pursuits, when at the end of the day, the community says, this is not for us, right? And so there needs to be, just sort of like you're saying, that cultural change of where that power lies and what that then means when the decision is it's a no-go, right? Yeah. I think we have some other questions.
Yeah. Well, thank you for your response, Dennis. Absolutely, scalability of data technologies is crucial to reducing AI inequities, and looking forward, we have to make sure that we have strong risk management processes in place. I'll turn it over to Jennifer, who has a question.
Thank you. So I'm in the room. Thank you for a lovely talk. I feel like you walked through such a clear argument for the inclusion of the disability community. I think my question is for those who maybe are a little less familiar with AI processes. I don't know if there may be the idea that once you collect good data, and I think you made a lovely argument for talking about having the disability community involved at that stage, that maybe you can just feed it into a system and that system is agnostic. And of course, that's not really the case. So if you can talk maybe a little bit about involvement of the community along that pathway, I think I would love to hear your thoughts on that.
Yeah, thank you for asking that. That is it's a really good question. It's a really important question. I have a list of verbs that I tend to talk about when thinking about this, and I'm trying to bring them all to mind. But when we're talking about when we're trying to talk about bias and equity more broadly, and kind of think about aspects of justice and the use of AI technologies, there are anchor points that you have to be thinking about in the conceptualization. What idea am I going to try to do? What thing am I going to try to do in the world? In the design, so that was most of what I was talking about, because that's most of what I've been working on, is the sort of design aspects. In the implementation process, who's in the room for that implementation? How are you how are you going about implementing it? What's the sort of organizational culture in which that's happening? In the use of the technology, so who's going to be using it? How are they going to be using it? And in the management of it, the auditing, the life cycle planning, everything that goes into that. And I try not to drop that full list of verbs too often, because it becomes very overwhelming. But your point, like exactly to your point, there's often something of a narrative of, once we can get good data, once we can say this, we can get good data and we can get good algorithms, then we're fine. And it speaks to a technocentric view of bias and of AI bias and AI implications and inequity are a technical problem which can be solved through technical approaches. There's a lot of, and I don't want to shortchange people, there's a lot of really fantastic research and development that's going on technical approaches that can inform that process, on being able to say, from a technical perspective, this is what's going on in my data, this is what's going on in the algorithmic behavior and the patterns that I've learned and the way that it's interacting with data changes. Those are really valuable, but those technical observations have to be put into a social context. And it has to be seen as a socio-technical process that is people doing things with information. I mean, this is really the root of it, is technology is the grease on the wheel. But what we're talking about, what we're doing, is people doing things with information. And so the sort of risk management, the risk assessment, the how do we deal with this, has to come from that perspective of what we're dealing with is not a question of data. It's not just a question of data. It's not just a question of algorithmic design and implementation. It's a question of people doing things with information, and those are parts of the process. So that may be a more general answer than what you were looking for, but I think it really, it really is a whole field of work, or multiple fields of work. And I think what's really needed more systematically is greater integration of AI, not so much as a dedicated field of and like a walled off field of study, but as this is a family of technologies and a family of techniques that have implications for many other fields, speaking to all those things that I just talked about, and where the work that's going on in those fields can feed back into what developing good technologies looks like. Technology is not a technology problem.
Thank you. Thank you.
Thank you, Denny. That's very, I feel like we could talk about that for a long time, right? It feels like a discussion in and of itself. I mean, an offshoot discussion. I appreciate it. I know there was another question, but I guess it was more of a comment typed in, and I think, Franz, you had already gotten to it.
Yeah.
So, go ahead. Sorry, Franz.
So the next comment we have is says, thank you so much, Denny, a very important message and great presentation, including perspectives from persons with disabilities when developing AI that is being designed to extract information on participation, functioning, and quality of life information would validate this NLP tools.
Yeah, absolutely.
Yeah, go ahead.
Yeah, so just to respond to that for a moment, I mean, thank you for the comment, and I very much agree that there's a particular role to highlight in validation, and I think this speaks to the previous question as well, that it's not just a question of like, do we have good data? It's also, I've built this thing to do a fairly defined purpose. So again, we can take that example of I've got medical text and I want to find information about functional limitations that's in it. Well, that's a fairly relatively defined problem, as problems go. So I can build a technology to do that, and I can use data to inform that, but then I have to tell, is it working right? Is it working well? Is it working effectively? And is it working fairly? And there are quantitative measures that we can use for, and that we tend to use in AI technology development and research. We tend to use these quantitative measures of, okay, this is the thing that I should be getting out. Am I getting it out? If so, great, move on. But these more, the question of utility, the question of impact becomes something that's much greater than the quantitative measure. And thinking about, starting to break down from the sort of very general thing that I was saying a moment ago, to thinking about, well, when we want to do validation, we want to do evaluation, we need to be building in processes, and we need to be building in measures for saying, this is what, like, I don't want to, not to dictate this is what engagement with disabled perspectives looks like. That's the wrong way to go about this. But we need to be building in disabled perspectives. We need to be making sure that disabled perspectives are in that discussion and leading that discussion of figuring out how do we validate this. And that, that's, just to get in the soapbox for a moment, that's a problem of, again, both people and concepts. When I say a disability-led discussion, that can mean both a discussion that is led by a person who identifies as disabled, and it can mean a discussion that is led by disability justice-oriented definitions and concepts that I'm not trying to argue that all AI teams that are doing things related to disability, or all AI teams more broadly, need to be specifically led by disabled people from like an organizational or structural perspective. If you're developing an AI technology that's related to disability, you'd better have somebody on your team who identifies as disabled, because if you're not, then that is a representational issue. What is more fundamental, though, is that the way that you are doing that process, the way that you're doing validation, the way that you're doing data collection, the way that you're doing all these things, is centered around disability-centered definitions and disability justice concepts. So apologies for soapboxing up the Q&A time for a minute, but I wanted to follow up on that point.
That actually was a very beautiful way, I think, to end this discussion, because to me, what I'm taking from that is what I think this whole series is about, is that disability justice needs to be infused across all the things we do, just like understanding, justice for all communities. But for disability justice, we're still at such a starting point of understanding in society. And it's still a radical idea to think about this disability justice in these places. And you just summed it up so perfectly and beautifully. And I really honestly couldn't think of a better way to end the series, to end this conversation. So, and with that, I want to thank you for your time. I know it's late where you are, and all of your work and just the things you're doing, which I'm a huge fan. And I hope everyone follows Denis' work. And thanks everyone for joining us today for this discussion. We will be posting the captioned recordings of this and all the other sessions shortly. So stay tuned. And thanks for everyone working behind the scenes to make this happen. Thank you so much. I really appreciate the conversation.
Thank you.